Good evening, good afternoon, and good morning. This is the 1901st day of the continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VEENA C. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy has celebrated its birthday 1900 day yesterday. And today we are entering into a new phase, that is countdown has begun for the 2000-day celebration. So it is just it's not simply another day, it's a celebration day for us, and 1901st. So let us introduce the guest of the day, Dr. VEENA C. She is practicing homeopath at Hyderabad and running her practice there. And she is actually from Kerala. And she took guidance from Dr. Bhagilashmi, a leading practitioner in Trivandrum, and is a classical example of how homeopathy, how a new generation doctor can dedicate her knowledge to the budding doctors as well as the senior doctors, and she always come up with a different subject, and all the subjects are really brilliant, and all the presentations are entirely different from what other we are getting from the normal presentation. So today doctor will be discussing about another subject, that is the PQRS of homeopathy, and we proudly welcome the guest of the day, Dr. VEENA C, to this session. Welcome.
Namaste, sir. Namaste to all of you on the platform. Thanks for your time and thanks for giving me yet another an opportunity. So I am just sharing the screens. The screen visible?
Yes, everything visible. You can go ahead.
Today, I'm going to tell that homeopathy itself is a PQRS system. So first of all, a very happy Children's Day to all the younger ones here, by age or by heart. So a very happy Children's Day. So I'm very happy to present about homeopathy, the PQRS system. So now, homeopathy, why is it a PQRS system? Why, as we all know, um, homeopathy itself, or Dr. Hahnemann himself has told that symptoms are the language of the vital force. So, as we know, we are treating through peculiar, cure, rare, striking, singular symptoms. So what is peculiar? Which is unique. So our system, homeopathy itself is unique, and cure, rare, striking, and singular. So this is the only system which itself, by itself, is the PQRS system. So why is it PQRS? So first of all, homeopathy is a system which is based on clear-cut principles, and that is the core of homeopathy. So in which drug proving in healthy human beings is the basic part. So our materia medica is based on drug proving, which is uh, uh, proved on healthy human beings. Every Ayush system like Unani, Siddha, Ayurveda, they also claim that they are tested in healthy human beings. But here the peculiarity is the symptom similarity. So every other system is acting through antipathy, though there is a mention of um, like cures like related phenomena in Ayurveda, but majorly their therapeutics is based on opposite cures opposites. But homeopathy is the only system where we prove the drugs in the healthy human beings, bring out the symptoms, and we are giving those medicines to the symptoms in a diseased person to cure the same. So every Ayush system, again, they claim there are quotes about. I'm sorry for the
Oh,
delay. There was a power cut.
no problem, no problem.
Yeah. So
No,
we were talking about why homeopathy, why it is a PQRS system. So I told about drug proving, which is in the healthy human beings, and the symptom similarity. Then we have individualization. How many systems have this individualization? Very rare. So it is a rare system altogether. Then we treat the cause, exciting cause and the fundamental cause, and we advise everybody what are the obstacles to cure and help them to do the lifestyle modification also. And we have the Dr. Hahnemann has largely given about the classification of diseases, how he classified the acute diseases like pandemic, endemic, epidemic, and all those, and also regarding the chronic diseases. In chronic diseases, he clearly mentioned about the pseudo chronic disease and artificial chronic disease and double diseases. So he gave a clear cut view of how the medicines, when it is taken in large quantity, how does it affect cure in the human beings, like how does it act in the human beings, whether it is curing the disease by just removing the symptoms or creating a new disease along with that. And even if there is a natural acute disease on a chronic disease person, then how the acute disease takes over and sustain for some time and get cured by itself or end the life of the patient. If it gets cured, how the chronic disease comes back to the person. So he not only classified the diseases, he gave clear-cut view how the medicines act on human beings and how is the symptoms getting removed, and why are we here to say like whether it is a simple recovery or a cure altogether. So he clearly mentioned about how does the cure happens, how the artificial chronic disease, that is the dynamic doses creating an artificial disease in the human being, which is very dynamic and very small, where the vital force itself enough or sufficient to take over and tackle the um, tackle the artificial chronic disease, which is caused by the dynamic doses and thereby naturally doing the healing process. So this is nothing but a natural healing process. You're not giving anything artificial from outside. You are just triggering the vital force to remove the artificial chronic disease, which is created by the dynamic dose. So this dynamic doses are nothing but the medicines which are potentized and given in a very low, minute dosages, so that it creates an artificial chronic disease-like state, but the vital force itself has the power to conquer the disease and annihilate the disease, and thereby pushing the human himself um, to a natural process of healing. So this is a singular system which has such a phenomenal background to do the cure or initiate the cure of the human beings by himself and to come to a recovered state. So Dr. Hahnemann also guided us to check, how to check whether it is a cure or a palliation or a suppression. So he also quoted about the Herring's law of cure. So as homeopaths, we believe in Herring's law of cure and see how it is getting removed from the higher organs to the lesser organs, inner to outer, and more severe to less severe symptoms, or from syphilis to sora. So from which we can understand that our medicine is working in the right direction or in the wrong direction. So our homeopathy, it is working on both the genetics, which is the DNA changes, or the epigenetics, which is just a switch off on and off mode, which is creating a protein imbalance or a change in the genetics for some time. So, and create a mutation or a state where disease like state. So wherein homeopathy is dynamic enough to get through the genetics or the epigenetic plane of the particular cell or the whole human body and push us towards the health. So that is why we say PQRS. So PQRS is really PQRS. So we will just go through what shall be taken as PQRS and what does Dr. Hahnemann state about this in his Organon of Medicine. So homeopathy, the PQRS system, treat with totality, consider the sensitivity, reaction, and also the disposition of the patient, then arrive at a medicine. So how are we concluding that the medicine is similar to the particular disease or not? By taking the totality. First, case taking is very important. So that is the art. Then we are going to bombard that case taking by finding by setting the symptom similarity totality and finding the exact match of the remedy and going to bombard it with the remedy and going to heal the patient. So this part of selecting the simillimum is art and mathematics. So this is a science which has an artistic part and a mathematical part. So you go and fit the right medicine on the patient, then there is an artificial chronic disease, dynamic disease, which is annihilated by the vital force itself. Treating with striking singular symptom. So when we say totality, we take all the symptoms and we see what is outshining in the symptom, which is very striking for us, which is very peculiar, unique for us. Then we treat that and we create the cure. So this is a PQRS system. Then instead of a surgery, we are avoiding the surgery and giving cures. So this is a surgical knife. So how many system with medicines alone is capable of curing surgical cases? So it is a peculiar system itself. Then it acts both preventive and therapeutic. When we say therapeutic, it is curing the disease. When we say preventive, it is not only a genus epidemicus, in other context also, when we bombard the human being with dynamic dosages, thereby we are even preventing the oncoming disease, that is, which is going to come in future, because there is a soil of miasm. If it is left untreated, today one disease is cured or recovered, but later definitely because of the miasm lying behind, this patient will definitely end up going to the higher miasmatic stages and will get diseases accordingly. So when we say preventive, it is not only preventive of the particular disease, but the disease which is going to come in future. Either it will delay, so prevention in delaying, that is delaying the process of getting diseases, or even protecting the humans from getting future diseases. So this I have said before also, like when we treat a patient who is coming with warts, we are treating the psychotic miasm or the psychosyphilitic miasm inside the patient. Thereby, we are preventing or protecting this particular person from a disease which is of psychosyphilitic character, which is going to harm him more in the future. So thereby we say it is a peculiar system. So which system has this anticipation of protecting the patient from a future disease? I think that is very rare and unique, and that is homeopathy. So who are the homeopaths? So now we are coming to the main thing. We are the crowd. We are the folks who are the homeopaths, very proud homeopaths. So why do we, how are we treating the patients? Through the PQRS system and the symptoms. Then we can call ourselves as the PQRS specialist. So what is PQRS specialist? Perseverance. So we will not give up. One patient, he is not getting cure faster. We are taking case in every follow-up until there is a clear-cut cure or recovery for that particular patient. So this don't give up attitude is there inborn or getting, because we are all homeopaths and getting trained in colleges and under many legendary homeopaths, we, and as we all say, anything is not that easy. No pain, no gain. So we get the pain, but we have that perseverance, do not give up attitude, until we find the right remedy and hit the particular miasm and the particular disease and get the cure. So Q, how are we cure? Because we are curing the patient, and we should be with high IQ. This is not only about the intelligent quotient, but also the interactive quotient. So we have to communicate with the patient to get the right symptoms. So to develop the rapport, definitely whether we speak more or less, but that interactive quotient to keep the patient rapport with the patient and to bring out the symptoms from the patient, we require a lot of patience and also the interactive quotient up in our practice, so that we bring the right symptoms out, we pick the PQRS, and we can select the right remedy and treat the patient positively. So we are the inquisitive questioners who keep questioning the right way. Patients may, if you allow the patient to start speaking, if the patient is loquacious, they may talk continuously and may take you to the wrong, right, left, and every route possible. But we should be an inquisitive questioner, where to stop, what to bring out, what kind of questions to put to halt the patient from going outside the conversation and to bring the right symptoms out. So a homeopath always should have an high IQ, that is nothing but the intelligent quotient and the interactive quotient. And we are resilient. When we speak about resilience, um, to not only to give up. See, every time we fall, we should try to get up. So until we create that cure outcome from the patient. So by then we are the natural healers. Since we are resilient to bring the natural healing um, to the surface and make the patient get cure, we are natural healers, and that is why we are the rare specialist. So, and the striking and singular specialist, or the specialist ourselves, because we can easily call ourselves when we treat all the surgical cases without a knife, then we can say a silent surgeon. When you don't counsel for hours or days together, give appointments for counseling. Instead, you give one dose, and that dose is acting as a counselor or the antipsychotics, and clear the psychiatry problem what the uh, people have. So we can call ourselves as the silent psychiatrist, come psychologist, and the super specialist, what not under the sun, whatever diseases we have. Now we are even using agro homeo, we are using wet homeo everywhere. See, we are creating impact with all the life surrounding us. Not only the life, even the carbon print we are reducing by using the system homeopathy. So we can call ourselves proudly as silent surgeons, silent psychiatrists, silent psychologists, silent super specialists. Then when we talk about symptoms, definitely we have to go through two aphorisms mainly. One is the fifth aphorism and the other one is 153rd aphorism. So what is the fifth aphorism say? You just go to the basics. See what is the cause of acute disease, that is the ailments from, what is the cause of the chronic or acute disease, that is the miasm behind. Then also investigate in deep and find what is hindering the cure. Maybe his occupation, the habitat in which he lives, or his social situation. So take into consideration and give the resolution, and so that the cure is possible. So this is the fifth aphorism. This should be taken care, like we all have studied in college, and this should be remembered while every case taking. So all the touch points, like what is the ailment from, that is the cause, that is the dynamic cause. We are not only getting to see the material causes, we are going behind and see the dynamic causes. What is the perception of the patient, what is bringing, what is on the plane, which miasm is on the plane, and his other circumstances, so that we treat, or we are seeing the core problem of the epigenetics and genetics in the patient before treating any patient. Then we have the 153rd aphorism, which is talking about the more striking, singular, uncommon, and peculiar signs and symptoms. So this one aphorism states that you can easily find the symptoms remedy through the symptom similarity, by not matching 100 symptoms and finding a similar remedy. You can just go through, fit the case, see what is peculiar, what is more striking in that particular patient, which is singular, which is very rare or uncommon in this patient, and accordingly you fit your prescription so that the cure is inevitable. Then today being the, so now I think we will go to 3 of my cases, treated cases. Since today being the Children's Day, I thought we will start with the child case. So never let age extinguish your inner child. So whenever we are with children, we really, I have felt so many times that sometimes we are not equipped enough to bring up the children, because we are prejudiced and we are unable to understand their world actually. So this is a case of a child of 9 years old who came to me in the month of April 2025 this year. So the mother was complaining that she has leg pains aggravated in the night, and which was ameliorated by pressure. And there is a weird behavior in cold as well as hot atmosphere. She told something weirdly what the child states, and meaning that she is very uncomfortable in both the climates, and the child is highly thirsty. And while during birth itself, child has 2 teeth. She is very adamant and obstinate, and this girl asked the friends on face, like questioning if anything harmful or anything which she didn't like or which is not up to the mark. This girl this child goes and asks on face. She will not like call the mother or any other person for support to go and talk to anybody, whether they are elders or children of her age, of elder age, or the smaller group also. So do not let go behavior. She cannot forgive. And she always say, you did like that, no? You correct it. You did like that, no? You correct it. So this child came to me with these symptoms, and I have given a symptom with these um, symptoms. First, I thought it is growing pains, and I gave her calcirepaz only. But um, to my surprise, calcirepaz did not work. Then I took the case again in the month of June. Then I have to change the medicine. And I also asked for the vitamin D reports, because these children are COVID children, always at home in the pre-toddler, toddler, or in adolescent age group. And definitely I thought there will be some problem with the vitamin D and HB as well. So I did ask them to bring the reports of vitamin D, and it was very low. So now this June, I changed the prescription. Then in the follow-up month, August, once the symptom similarity, the medicine was picked with the exact symptom, then we had a follow-up in the August. Then we saw the skin rashes appear. So, which was again according to the principles of Hellring's law of cure. But I was little bit tentative. I was not sure. I asked about the symptoms of leg pains that were reduced, but I wanted to wait and watch. I didn't repeat the medicine. Then October 25, I asked them. They told the child has only very occasional pains observed, but tolerable. So now, what is the choice of remedies? So when I repeatized the case, initially generalities, pain, growing pains. Then injustice, cannot support children. These are 2 striking symptoms in which I have the calcirephos, Cali group exactly, and phosphorus also, and natrum groups coming up. Then I have mercurius also. Then this child being born with 2 teeth, which is highly syphilitic in nature. I don't want to target medicines which is in psoric or in psychotic groups. So I wanted to try a anti-syphilitic. So I go got back to the basics and saw Merxol mind symptoms, which was matching with the child, like ambithermal, she is thirsty, aggravation in night, born with 2 teeth, and quarrelsome or a malicious behavior noted. So I gave Merxol, and in the month of August, we have seen appearance of some skin rashes. So this is from syphilis to SORA or psychosis to SORA coming back. So the deficiency might be also getting corrected. That is why she is having occasional pains. I have called for the vitamin D report, but I'll wait and watch to repeat the medicine. This is the first case. So here, this is the singular striking symptom along with the disposition and sensitivity and reaction taken into account to give to the child. Second, we have a case of patient of age 48 years. She had a small ulcers in the leg, especially the right foot, which was burning as if some fire in the feet. This patient came in the month of February or March 2025, and the patient told that she used to cover both the feet with plastic covers while taking bath. Recently, her mother passed away, and she is a loving, caring wife and a mother of 2 children. She has insomnia also. She doesn't sleep well in the nights, so sleepless nights. Follow up in the with these symptoms, and I called for a few tests. This Doppler of both lower limbs. Then I got to know varicose veins, both lower limbs, reflex at the saphenofemoral junction at this place in the thigh. So there is a reflex at the thigh itself. So, but it is affecting only the feet, not the other areas. And here, of course, varicose veins are visible, but there are ulcers in the foot. So now I wanted to I took the case. Now I went to the striking symptom, burning fire like in the feet and unable to pour water in that. Unable to pour water in that. So I took this symptoms and I got in nerve repertory, I got burning ulcer, burning as from a hot coal. The single remedy is Pulsatla. So I went and saw the Metri Medica, Herring's Metri Medica, got to see like burning as from glowing coals near or above an ulcer on food just before dressing, morning and evening. This symptom I have seen in varicose veins on legs and regarding the ulcer in Pulsatla. So after I gave Pulsatla in the month of April, then I had the follow-up in the month of August. Overall health improved. So the patient told that she is getting sleep, ulcers are gone, but dryness and other things were there. But she removed the plastic covers while taking bath and working in water. The next follow-up has been taken October 2025, but we have seen like some more oozing appeared again, but there were no ulcers, but there is some discharge in the feet again. So I have repeated the dose in the month of October. So this is an ongoing case, but the results are evident because overall health improved, ulcers are gone, and she's keeping well and she's sleeping especially. So I'll just show the photos. So this is the feet, and this is in April 2025, and this is August. This is April 25, where these are all oozing lesions. They are not very clear. And this is August 2025. So in March, it were more deep and the ulcers were burning, but at that time I never thought this will cure so fast, so I didn't take the snaps. So these are the snaps, and this is the present condition of the foot in August, and it's better now in October. I just called her on phone, so I don't have the snaps. So here, this is an ulcer case. As I said, we have prevented in this patient from going to a big ulcer, turning to a gangrene and all that. She is just 48, and with remedies, we have prevented that stage. That is one thing. And we have recovered from that burning coal like feet and sleepless nights and all those things. And probably she has healed that um, grief of her mother passing away. Probably these all triggered, those emotions have triggered her condition, maybe. But the medicine, homeopathic medicine, has healed from inside. That is why these results are there. Then the case number 3, this is a very old case. This was treated by my guru, Dr. Jyoti Ramlingam. When he was one of my inspiration to go get into homeopathy and into a homeopathic medical college. So this doctor belonged to a village in Tamil Nadu, and he has treated a traumatic ulcer when I was in college. I was a witness to him, so courtesy to my guru and my pranams to him, because he is one person who has brought me to this system, where I was fortunate to be under him for some years, to know what he is doing. So this particular patient was almost 40 years old at that time. He had a traumatic ulcer. That is, some glass bottle got broken and it got hit in his feet. And it became a big ulcer suddenly, because the glass piece was inside. So when it was pricked by the glass piece, silicea was given, the piece was taken out, but ulcer eroded on the whole feet. And they were thinking like whether we have to go for plastic surgery, antibiotics, injections, and all those things. So when they took for diabetic test, he was diagnosed as pre-diabetic. It was in the borderline. So this case, doctor has treated with only homeopathic medicines and external dressings with gunpowder he has given. So the remedy selected was sulfuric acid. I was too early in homeopathy, so I have just seen the symptoms in sulfuric acid. Bad effects from mechanical injuries with bruises and livid skin, ecchymosis, purpura hemorrhagica, livid red, itching blotches, hemorrhages of black blood from all outlets. And there is a chilblain with gangrenous tendency, carbuncles, boils, and other staphylococcal infections. This was the condition of the foot before, and later this is the after. Within a couple of weeks of treatment, there is a granulomatous tissue, and it is towards the healing. So it healed almost in 4 weeks, but that one spot where that glass prick was there, it took at least 2 months to heal. But this person survived without surgery, and he is hale and healthy, and he didn't have diabetes up to the age of 60, as far I know. I don't have the rest of the history, but still, to my knowledge, this is the thing. And I just wanted to give the courtesy to Dr. Jyoti Ramalingam, and I wanted to present in this forum because sir is of maybe 85 plus now. My pranams to him. So these are the 3 beautiful cases. Again, so this is a surgery case, escaped from surgery. That is the power of homeopathy. So I would like to conclude this session with 2 beautiful things. One is a quote and one is a story. So being Children's Day, I thought story is the better way to convey things. This is a commentary or a quote in Organon of Medicine with Dr. B.K. Sarkar's commentary, in which B.K. Sarkar comments that the best public health is the sum total of individual health. Health is not merely a state of being, it is power. Health is the power to resist, the power to recover, the power to adapt life to conditions without fear, and to live a full life in this world. So the aim of homeopathy is to build that power. So a beautiful quote. So the aim of homeopathy is to build the power, and this is the intersubjective narrative which we have to create in the society, among the public, among the students, and inspire them to take or make use of homeopathy and keep the entire land or the entire humanity and other living species hale and healthy. Then I have a small story to say. So Dr. Herring was being asked by his professor to go and check on Dr. Hahnemann's practice and to write all um, actually the negative things about what Dr. Hahnemann is doing. So that Herring was appointed as a spy to do this negative propaganda against homeopathy. And he went to Dr. Hahnemann and got to see wonderful results. And he himself got converted to a homeopath. And he came to America and started practicing homeopathy, where he couldn't even bear his bread and butter. He just lived a very normal life and he couldn't make the two ends meet. So he wrote to Dr. Hahnemann stating his very poor condition there, practicing homeopathy, leaving his allopathic practice. So he got a what to say, a great reply from Dr. Hahnemann. So Dr. Hahnemann's reply to Herring was like this: "You are poor, my dear Herring, very poor, but you are rich in faith and truth. Continue steadfastly in the good work, never despair. He who clothes the lilies of the field and feeds the birds of air will not forsake you. Truth must triumph, and with it you. Truth must triumph, and with it you." So our basic um, quote, Indians what used to say is Satyameva Jayate, and truth alone triumphs. So likewise, homeopathy will always win, and it alone will win because it has the truth and the basic principles, basic humanitarian principles underlying it. With it, I conclude today's session. Hope you all enjoyed it, and thank you for the patient listening.
Thank you, Dr. Veena. Excellent session from you. And really, the quote itself says that homeopathy can do such things. You have to wait, then you will reach the optimal level. And this is what you have said. You just end up with the session. All the cases were brilliant, and your methodology of giving selecting the medicine is also excellent, because that's the reason why it just went on with the PQRS and how it helped homeopathy to become famous, as well as to win the patients over his diseases. Thank you once again, and this is the time for discussion. Those who want to participate in this discussion can raise your hands so that we will enable you to unmute yourself, and you can ask your question, as well as you can comment upon this presentation. Yes, Dr. Manoj.
Thank you, Dr. Sanesh, and we must congratulate Dr. Veena for she is so brave to present such a topic, because unfortunately our fraternity is not at all bothering about all these basic things. The number of participants is very much evident how much they are participating. But anyway, the last point you mentioned is that they're redefining public health. It is done by Dr. B.K. Sarkar. Then according to that redefinition, I think the recent health definition by the World Health Organization was redefined. Not physical, mental, social, spiritual well-being. It's redefined. Then again, you mentioned about this, the unprejudiced, why you succeeded in such cases, because you approach it unprejudiced. That's the reason. Otherwise, you will not give pulsatla. Isn't it? So that is another point. Then again, the PQRS is the pathology of homeopathy. That we must understand. So don't read behind all these pathologies, but we have our own pathology. So these PQR symptoms are the real pathology. Then another point is that you mentioned about this, the case taking. It is in fact, it is accurately sketching the picture. That's not portraying. So with the minimum points or characteristic features, you can complete the process of case taking. That is exactly you have done. That means you are an experienced campaigner. Anyway, congratulations. And the last point you spotted about the Herring's the problem and the address based on Samuel Heniman. It's a wonderful. Thank you, Dr. Veena.
Yes,
Thank you.
excellent comment,
Means a lot.
Manoj also. And now I invite Dr. Selvi for her comments as well as her explanation.
Hi,
Yes.
thank you so much for invitation and IFPH, all of IFPH members and Dr. Veena, thanks you again. And very, very clear explanation and all explanation excellent, really. And thank you so much, Dr. Sakers and others. Important point is very good. And your case is excellent, really. And the pulsatilla case is important, and I have like these symptoms of one of my case, and pulsatilla is a good study of them. Thank you so much.
Thank you, doctor. Thanks for the encouraging words.
Yes. We never stick on to any particular medicine, but we just go up with the case and we can find that we will get the result, whatever may be the medicine you choose. But when it becomes a correct remedy, it will cure the case. So one need to look into the totality of the case in this way that as Dr. Veena explained here in this forum. Unfortunately, people used to say, oh, it will take a lot of time, but it is not. By experience, you can gain knowledge and how to sort out, how to enter the patient in a shortcut by using these techniques. Am I right, Dr. Veena?
Yes, sir. Actually, I mean to say, like during our colleges and when we are in the initial practice, though we were into the cases, we never read more books or never understood how they treated. We just were behind specifics and how to do that, find the shortcuts, but that is not the right way. I have recently get to read a book on outliers. What is it is how the people get succeed. So when I got to read that, really, when they say about this Microsoft and other mama companies, that is the Meta, Amazon, Alphabet, and and Microsoft, all these, how they become big, especially Microsoft. He has worked for more than 10,000 hours in the computer lab. And how will he not succeed? So they are saying if you the players who are hitting 10,000 goals, he will be the best goal.
Exactly.
So I think we need to be a patient listener, do a lot of work in homeopathy, keep repeating the same work, go and see what others are doing and try to understand what is the logic behind that instead of just going blindfoldedly following somebody. Because Dr. Bhaglakshmi used to say, like, see what I'm doing, but understand what is behind that. Don't ask questions, just go and learn and then come back and then you ask your doubts. Never she'll allow to directly ask doubts. She'll say, "Adanganya, it's like that. It's like that. You give this medicine." Like that she'll say. Then she'll ask us to read the totality, go back and see what it is. And then we sit and we try to understand what is the logic behind her experience. So she would have experience like giving for 100 such patients of that similar kind. So it is easy. So I really owe all my practice and other thing to all my gurus, especially Dr. Bhaglashmi, Dr. Ravindranath sir, Dr. K.V. John sir, and Dr. Jyoti Ramlingam, and all my teachers in my college, who has given me real insights about homeopathy, and definitely to IFPH platform also, because many things are available online. Only thing is we have to find the time to go and search what we want and try to understand the logics. So online platform after COVID has really helped me a lot. It has opened a wide range of wisdom which helped me to instigate all these things in my practice. Thanks for everything. And thanks to all my gurus, to Dr. Bhagyalakshmi and other gurus from Kerala especially, because I never knew the language. I never knew how to approach an acute case immediately after from college. I learned, I owe everything to my gurus. Thank you, sir.
And
Yes, sir.
definitely that will imbibe not only this courage, wisdom, patience, and courage. All these things came during this COVID period. That's my comment. Thank you.
Yes, yes, exactly. Now, Dr. Rampraso, sir, you can say your comments.
Thank you, Dr. Dhaneji, and Namaskar, Dr. Manoj and Dr. Saila. And congratulations, Dr. VEENA C. Very good presentation and case is a very good. Select the remedy. PQRS presentation. PQRS is the important, essential in every homeopathic doctor. PQRS and select the remedy, select the rubrics, useful of remedy, very useful of chronic and complicated disease according to PQRS and sensation, location, moderator, location, etc. Routine, appetite, thrust, every cover the rule of homeopathy, kinds of rule of homeopathy, PQRS, every doctor's essential. So very, very thanks, Dr. VEENA C. Thank you. Thank you.
Thank you so much, sir. And I really thank IFPH platform to always give me an opportunity to present my limited number of cases. But I really, as I always say, that interpersonal narrative about homeopathy should be built. I think that is one of our duties as homeopath. Thank you so
Yes.
much.
Yes,
Thank you.
definitely. We need to look into that way. That's what we are doing here also. Because when a presenter come over here and deliver his or her presentation, we used to give some minutes for discussion. Thereby, we can interact and we can add something more to the presentation, or sometimes we can take some more things from the presenter. That's what you have done it in this session. You simply not only came over, whether it is a case, a single case, or two case, or three case, it doesn't matter much. What matters is the content, how you, as you rightly point out, how one choose the medicine. And this is what is the problem with the most of the doctors. They have no time to wait. They are just saying that. Then when they fail, oh, they say that the homeopathy is a failure. But it is not like that. You will have to find out, work hard, why I failed in this case. Then you will definitely get the reason behind the failure. And once you find the cause behind your failure, you will be a winner thereafter. That's what as you told, there's Microsoft persons and all those people who achieve their target has done in to reach their goal. So every homeopath need to work in that way. That's why we used to say that you come over here in these webinars instead of simply watching the videos. So people used to say that, oh, you're uploading the videos and we are getting chance to see. But not only simply watching the videos, but you can also come over here and you can add something more, because you may having an experience of something like that the presenter has presented. So that will be a booster to those who attend the session also. Thereby, all the sessions will be attractive. Even if sometimes the presenter may be a little bit weak, but in those conditions, we can add many things more to the presenter's content. Thereby, we will be able to reach our target, that is propagation of homeopathy, thereby winning the goal. So with that, I am thanking Dr. VEENA C and those who attend the session this evening. Thank you all. Good night.
Thank you,
And
sir.
today,
And a very congratulations to the fifth year of 5 years completion of IFPH. Thank you,
eh,
sir. Thank you so
yes,
much.
as I rightly point out, we are just 90 to 98 days to reach our 2000 Day. We are waiting for the big celebration on 2000 Day.
Thank you, sir.
And
Thank
we
you,
are also congratulating the children for this Children's Day activities, and we can have a happy Children's Day. Thank you all. Good night. It's over to
Thank
Dr.
you.
Manoj.
Happy Children's Day.